Greetings, friends and followers. This is Nurses Talking. I am Dale Barzy. As always, if you like what you see and hear, subscribe. Leave us a comment. Let us know what you think. Here on Nurses Talking, we speak to nurses anywhere in the world and at any stage in their nursing journey, from students to retirees and anywhere in between. Today, I am very, very pleased to welcome Molly Judge out of Indiana. Molly is a vascular access specialist. She's a clinical educator. So welcome, Molly.
Thank you. I'm glad to be here.
I appreciate you being here. So tell me, why did you become a nurse?
Oh, wow. I didn't think I wanted to be a nurse. I had initially started in the healthcare profession area when I was in high school, thinking about it. Physical therapy, I thought would be really good. Of course, as a 17, 18-year-old, I was thinking about where the money was, and I knew I didn't want to go to medical school. So I just was looking at different avenues. And while I was at the University of Kentucky, I got a job as a student nurse technician at the VA hospital in Lexington, because they didn't have student PAs, or student physician assistant was something else I was looking at. I was amazed. I had never taken a blood pressure. I'd never even, I guess I'd taken temperatures because I had lots of brothers and sisters, but I just could not get over what nurses did. And I worked on an oncology floor. We lost a lot of patients. They were very sick. I also had the opportunity to work with all of these veterans at the VA hospital. So that in of itself was pretty amazing. And I had a particular patient who I was one-on-one with one night, who couldn't see because of all the swelling in his face from the cancer that he had. But I talked to him all night long. When I get nervous, I get chatty. So all night I cleaned him up, had to keep packing some of his bleeding that he had, and stayed with him all night. And I thought, he's not going to be there when I get back. And I was off for 2 days. And when I went back in, he was still there. And I went in and to do my vital signs as a tech. That's what I did. Or I said, "Oh, I'm so glad you're still here." And he knew my voice, and he tapped that he wanted to write. And he said, "Thank you so much for caring for me and being with me." And I thought, that's it. I want to be a nurse. I love the nurses that I was seeing there, but that just really spoke to my heart. And I just thought, if I can do that for a career, what better way to spend my life? So that's
I know.
Yeah.
And so you got your foot wet before you actually became a nurse.
Yes.
So you had an idea of what you were getting into. You knew pretty much what you were getting into, but still, what challenged you?
Oh, well, what challenged me was I married a Navy man. And I had already started in nursing school. I had done 1.5 or maybe just one full semester in clinicals in Kentucky. And then I married someone in the Navy. So I moved to South Carolina. So the moving around was a challenge to finishing school. So having to retake some clinicals because they didn't transfer, which I saw kind of frustrating at the time. But in hindsight, I had started in an associate's program, but the program that I was in South Carolina was a BSN. So it really was worth my while to repeat some of the stuff. Then I had a baby before I finished nursing school. So then that put nursing school on hold. And I just thought, it's never going to happen. Took me 8 years. And so that was a big challenge for me as far as the moving around with the military and having a baby. But it was also the blessing of nursing with moving with the military. I always found a job wherever I went.
Of course.
Yeah.
But so you came to this, by the time you became a nurse, though, you came to it with a wealth of experience. You were the tech, you're the Navy wife, you're moving around, you're the mom, you're, being innovative and adjusting all the time. I mean, you're doing what nurses do.
Right. Yeah, I really think also I was the oldest of 6 kids, the oldest girl, and I
Mhm.
think that I was just kind of born to be a caregiver. It really is. I know people talk about that it's a calling, and I really do believe it is, and that's a struggle at times
Yeah,
because I
yeah,
just left the bedside in March, because I was struggling with that calling that I have, but I just couldn't continue in the environment that I was seeing in the hospital setting.
yeah.
Um,
Mhm, mhm.
so I'm still searching for the best fit since then.
You know, one of the things that I want people to see when they see this and when I speak to nurses is that um the bedside really is really one aspect of nursing. There are so many other areas where nurses care for, because that's what
Right,
we do. Where we are nurses in so many other different areas that you don't have to, from the nurse's point of view, you do not have to be at the bedside
right,
to be a nurse, to be an effective, authentic nurse. And from the consumer's point of view, we can and we are everywhere. We can be. We are everywhere.
right.
Yeah. Yeah.
That's my favorite place to be because I like being right there,
Yeah.
touching the patient, having that, just
Yeah.
that opportunity to be a part of somebody's life and make it a little
Mhm.
better in that scenario.
Yeah. Yeah.
That's
Yeah.
really where I feel the most joy.
Yeah. I know. Yes, I get what you're saying. And it's in that area that you get a lot. You give a lot, but you get a lot too.
Right.
Yeah. So in all of this though, what would you say is the biggest, most impactful change you have seen in the time you've been a nurse?
Wow. You know, I think we're yet to see it, to be quite honest. I think that nurses are the caregivers, we're the helpers, and we do what it takes to get things done. Um, that's one reason that in the hospital setting or wherever you see nurses, a lot of times they're sacrificing their own well-being for the care and the needs of their patients or their clients or whatever the case may be. And I think that it's been expected for so long and we haven't really fought for ourselves to um, to to demand the value that nurses really deserve. And so I
Yeah.
think we're really at a crossroads right now that it could improve. Um,
Yeah.
I can remember starting IVs and not wearing gloves. I mean, there's lots of things that's happened through the years.
We have been actually I as you talk about that, I think it was actively discouraged for you to first advocate for ourselves.
Mhm.
You talk about, remembering starting an IV without gloves. And there was a time when if put on gloves to do certain things, people looked at you askance as if, like, you were being offensive.
Right,
It wasn't until it really wasn't until like the AIDS epidemic came along that that um, use of gloves for regular everyday things became the thing to do.
right.
Because we just, like,
And yet, like
um,
you said, if you put gloves on and touched a patient, it was almost like you were
yeah,
afraid of them or didn't
yeah,
want to touch them. And I think that therapeutic touch is so important that
absolutely.
it was really a challenge at the time. But
Yeah,
we have learned a lot since then.
thank God we have learned a lot since then.
Yeah.
Yeah. So we talked a little bit about things that have to change, I suppose. But what would you say, what in about 10 years or so, what I've seen, Molly, is that over the last 10, 15 years, a lot of change has taken place. Um, and I see it's on a roller coaster. What do you think you see in the 10 years coming up?
What I would like to see, and something that I've been working on in my quest to figure out how to improve nursing. And I must say that both of my children are nurses, my daughter and my son are nurses. And so I
Okay.
feel like as a nurse, not only do I want to improve it for future nurses, but these are also my kids that
Yeah.
are doing this role as well. So I feel like not only am I fighting for better patient care and better environment for nurses, but I'm also trying to improve things for my own children. Because you know, it's one thing for things to be hard for me, but I don't want them to be too hard for them.
Yeah.
So I have been looking, and I joined the American Nurses Association and my local state nurses association, and found out that there was something called an advocacy institute where they were sending nurses from each state. So I applied to volunteer for that because I thought, you know, I can't complain about what what's happening in nursing if I don't get involved.
Yeah.
So I had the pleasure of and the opportunity to be part of this. And one of the things, the first weekend that I went, one of the topics was something called an NPI that's used for billing. And so one of the things I've thought of in my role as a vascular access nurse and fighting for what's the best line and the best care for patients is we're trying to put in different devices that had been only seen that physicians had done in the past. At our facility, we were approved and started putting in central venous catheters. So internal jugulars, femoral lines.
Yeah, like the swan guns.
Yep. In addition to the PICC lines that we were already placing. So when I was looking at what like the reimbursement was for placing a central line, when the physician puts it in, there's a charge code that's attached to all kinds of procedures called a CPT code.
Yeah.
When the physician puts it in, then it goes to billing and the coders put it in, and then it's submitted for reimbursement. Well, as a nurse, we put in those same charges, but the hospital is not reimbursed for those procedures because I'm a nurse. So I reached out to the coders and said, what's happening here? Well, because I guess my name or my ID code is tied to being a nurse, it goes in the nurse bucket and not the physician bucket. And that nurse bucket is in the room charge, in the facility charge.
Yeah.
And that
in with the Band-Aids.
Exactly. And not that those things aren't important, but we're talking about a profession that's doing 95% of the care for patients, particularly, and I'm looking at it as the acute care setting. Nurses do stuff in every environment, but right now that was my focus. So in looking at a project for me to work on, finding out about that NPI code and knowing, or NPI number, knowing that there was something out there that nurses could request. It doesn't cost anything. And we could at least not get reimbursement, but at least be able to track the data on what nurses are doing. And in that quest, I was looking at, you know, how things, where they came from and where we could be going. And I found something called the Commission for Nurse Reimbursement, which is on LinkedIn. Rebecca Love and Sharon Parsons, I think, are two nurses that had started it. And they had a call out meeting in May. So I joined the Commission for Nurse Reimbursement. I just started co-chairing one of the subcommittees. So they've divided the work into maybe 8 subcommittees to try to, like, professional organizations, business model. I don't even know all of the different ones, but working on different structures that nurses could get reimbursed for their care, so that we're not seen by facilities or organizations as a liability. First place you want to cut costs, it's easy to cut the room costs. And we just give nurses more patients, but patients are sicker and sicker. And it's just been really a struggle. So I'm hopeful that this commission will be able to work with different professional organizations, members of the government and things to make a difference and change that reimbursement structure.
Yeah, absolutely. No, no, that's you know what the thing is, Molly, is that if we don't articulate this and we don't it's not enough to just articulate it within our own groups. We have to put it out there. We have to talk about it. Because if we don't articulate it, we're not going to change it.
Right.
So we do have to change it.
I think that people are
Mhm.
very surprised to know that at least in the hospital setting, that the nursing care is not billed separately.
Not
And
done separately.
yeah, so patients see their bill and they see all of the different charges and they're like, how can that come out of the room charge? So
Yeah,
I think that needs to change.
yeah, 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 yeah. My goodness. But so what drew you though, first of all, to vascular access?
Well, that's a great question. So, like I said, I was a Navy wife. And so I kind of changed roles depending on where we were stationed.
Ah,
And for a little while, I started out in med surge in South Carolina. We moved to Maryland. I was on a med surge floor. And then I looked at home health. I just thought that would be kind of fun. So I did home health for a while. We got transferred to Guam, which is a little island in the
yeah,
Pacific. And I had a new baby and a 6-year-old, and my husband was gone 200 and some days out of the year. And I was approached about being the school nurse for the Department of Defense there in Guam. And I just thought, well, that's perfect, the hours and whatever. So I did that for several years, moving around with the Navy. When we got here to Indiana, I did school nursing, but it just wasn't what I was used to. And I didn't feel, I tried to make some changes in the program that I was part of with some resistance. So I thought, it's time for a change. And I quit my job and I looked for another job, and I had actually applied for a wound position at the hospital where I worked because I had done that a lot in home health and loved it. Wounds
yeah,
and ostomies were all my thing. And I went for the interview, and the first thing she said was, that position's been filled. But I thought that your resume looked good. I wanted to talk to you about maybe doing, at the time it was called advanced infusion. Would you
mm-hmm.
be interested in advanced infusion, putting in PICC lines? And I was like, wow, I've never put a PICC line in. I always wondered how they got there. I hadn't started an IV in like 11 years. So she said, well, we're willing to train you, come shadow. And I shadowed for probably 8 hours. I didn't even want to leave. I was so excited to see the things that they did.
That
And
they
I
were
started
doing.
that in 08 and have been doing it ever since. And sometimes well, not sometimes, I think I know that God has a plan, and sometimes you just
Yeah.
have to give it up to him to steer you in the direction you need to go. And that's what happened. That's how I
Yeah.
ended up in it.
Wow. Yeah. That's good. You have picked some things that I was about to say not for everyone, but a lot of things are not. Your
Yeah.
wounds and ostomies and vascular access. And I honestly appreciate when I meet somebody who is adept. And I'm just gonna say adept. I'm not even gonna say great at vascular access, because I think we don't actually until we are the ones actually feeling it. I don't think we give it as much credence as it deserves.
I agree wholeheartedly.
Yeah.
And it's just not the focus. I know that there's tons of other things going on in the hospital
Mhm.
or in any part of healthcare, but their vascular access is a part of it almost everywhere. You get labs drawn, you get IVs for
It's just mhm.
radiology test. It's not just medication going in.
What advice would you give to somebody who wants to be a nurse?
I think that I would probably say, first off, what are your reasons? Is it just because you know that they pay okay? I mean, it does pay better than
Mhm.
maybe a waitress job, maybe not. The pay is good. The clothes, I mean, the outfits are wonderful. Just kidding. Um, it is appealing to only work 3 days a week if you work 3 12-hour shifts, but what are your reasons for becoming a nurse? And I would say if you can volunteer in a hospital or any kind of healthcare setting, just to kind of see what you're getting into and understand it a little bit more.
Yeah.
Because there's so much to it. It's not just vital signs and band-aids and whatever. There's a lot of psychosocial things that you have to deal with. So really kind of grasping everything that it's about. And if you look at that and the reasons are the right reasons, go for it. But also take care of yourself along the way, because you cannot, we hear you can't pour from an empty cup. You have to take care of yourself along the way. And that's where I am right now. I'm trying to figure out, how do I take care of myself so that I can take care of people better?
Okay, good, because you just asked the question, you answered a question I was about to ask you, is what do you do for self-care?
Well, what I did for self-care was I quit my job. You kind of get to a point where you realize you've done everything you can, and I really struggled with that. But then I did put myself first and my family first and said, I've beat my head against the wall here. It must be time for something else. So I'm still working on that. I did start going to therapy and talking with someone about just the struggles that I've dealt with as a nurse. I think that's so important, to be able to talk to someone that's not worried about you. You want to talk to the family, but you don't want to stress them out, kind of thing. And I need to get better about moving, because moving your body really does help you feel better. So that's a goal that I have, that I'm working on. But definitely putting myself, it feels selfish, but putting myself first or higher on the list so that I can take care of the people around me.
Yeah. And we've really got to stop feeling selfish about it. But it's been kind of inundated into us that, if you take care of yourself, if you look out for yourself first, then you're being selfish. But honestly, you cannot do it otherwise. You cannot do it otherwise. You get to a point where you're just hitting against a wall. And I think that as we go along, one of the things that I would like to see change is really a robust part of the education of nurses, being devoted to, a lot of it being devoted to caring for ourselves. Because in learning to care for ourselves, we actually do learn to care for other people.
Right. And we can do better for other people if we're healthy and we're not completely stressed out. So, and I know that, like I said, my kids are both nurses. And so I would hear from my daughter, oh, I didn't get to take a lunch break today, 12 hours, 13 hours. And it's like, you have to go to the bathroom, you have to do these things. But I was doing the same thing.
But exactly.
And so it was kind of do as I say, not as I do. And then so it forced me to look at myself too. So because I was setting that example for other nurses.
And intellectually, she knows that what you're telling her is right. But on the one hand, she knows that she's got to do these things. But on the other hand, it almost is like, if you take the time to do this, then your 12 hours stretches into 14 or into 16. And if you don't want that to happen, then you kind of like pack everything and try to be super person.
Right. And I think that, back to the nurse reimbursement part, if nurses were valued in a different way and the reimbursement structure was different, maybe we'd have better staffing. And we hear about staffing crisis and things, but if they were cutting costs in different ways that wasn't affecting nursing and our staffing was better, you wouldn't be so worried about taking a bathroom break or a lunch break or going outside for 10 minutes and walking around the building and coming back in. Nobody even, you can't even fathom it at this point, at least in the acute care setting. So I think that it kind of goes hand in hand, where you haven't set up the environment for nurses to be able to do that. And we need to be better.
Right. The environment, in fact, actively discourages it.
Mhm.
Actively discourages it. But
Yep.
we will get past that. If you had to describe for me, lastly, but not leastly at all, if you had to describe what is the most essential quality of a nurse, if you could tell me just one word, what would that word be?
I think compassion.
Passion. Okay. It's a good one.
You know, we take care of people. It doesn't matter where they're from, what they do, if they're prisoners, if they're drug users, it doesn't matter. They come in, you care for that person. Treat people the way you want to be treated.
That's it. That's it. That's it. And you give the best that you've got.
Yep.
Yeah. Yeah. And sometimes you get the best that they've got sometimes.
Oh, it comes back to you tremendously. Yeah. We're very blessed to be able to do that.
Yeah. Oh, absolutely. Absolutely. I have never been able to, I think, adequately convey to someone, to describe to someone just how much I actually get back from doing what I do.
You're exactly right.
As much as I complain that I'm tired, I'm done, I'm not doing it anymore.
Right. And then you get that patient, oh, can you start my IV every time? Or
Mhm.
where were you last week when I was here? So yeah, it just fills your heart.
Yeah. Molly, it's been great talking to you. Thank you so very much for doing this. I appreciate it more than I can tell you.
Well, thank you so much for trying to get out just more info and highlighting the importance of nursing, because we really I do believe that we're at a crossroads and we have the ability and the strength and numbers to be able to improve things.
Yes.
We just need to band together to do it.
Yep. We need to take matters into our own hands and do it.
That's right.
Thanks, Molly.
All right. Thank you. Have a good day.
You too. Bye-bye.
Bye.